Hello, and welcome to the Prevae360 Medicare Advantage sales webinar. My name is Jared Hamill, and I'm one of the Medicare sales executives here at Prevae360. Today, we're going to go over some key insurance terminologies. We're going to talk about the 4 different parts, or as I call it, the ABCDs of Medicare. We're going to talk about how Medicare Advantage plans work. We're going to talk about how Medicare Part D works. We're going to talk about enrollment periods and who and when is eligible to enroll. We're going to go over our 2022 plan benefits. We're going to go over some things to consider when you're shopping for plans, and then how to enroll. So we're going to touch on some key insurance terminology. The first is premium, and this is the amount you pay for your insurance coverage. The next is cost sharing, and that's a general term used to define an amount you pay out of pocket with insurance. So these next 3 examples I'm going to talk about are all forms of cost sharing. The first is deductible, and that's the amount you pay before other coverage level starts. I like to use auto insurance as an example here. So for example, say you have a $500 deductible on your auto policy and you're in a car accident. And you take your car to the body shop and they tell you you have $2,500 in damage. You have to pay that $500 before the insurance will pay the $2,000. And it works the same in medical insurance. A copayment is a flat dollar amount that you pay for a service you received. Like, for example, if you have a $20 copay for a doctor visit, when you go to that visit, you do pay that $20 up front. Coinsurance is very similar to a copay, but instead of a flat dollar amount, it's a percentage. So for example, if you receive a service and you have a 20% coinsurance and that service is $200, you're going to pay $40 for that service. And then max out of pocket is an overall maximum you can pay for all cost sharing combined in any category or situation. Out-of-pocket maximum is a term you're going to hear me use throughout this presentation, and it's very important because it helps protect you from catastrophic loss. Understanding the ABCDs of Medicare. So the 4 different parts of Medicare we're going to talk about. The first is Part A, and that's hospital insurance. And that's going to cover things like inpatient services, skilled nursing, home health care, and hospice. Part B, also known as medical insurance, it's going to cover outpatient doctor visits, outpatient care, lab services, and durable medical equipment. And durable medical equipment are things like walkers, canes, CPAP, oxygen, any medical device that you would take home and use. Part C is what we're going to be talking about in detail today, and that's Medicare Advantage plans. In most cases, Medicare Advantage plans are going to have Part A, Part B, and sometimes Part D. They're always going to have an annual max out of pocket. I told you to hear that many times. And they may offer enhanced benefits like dental, eyewear, and more. Part D is pretty easy. Part D is for drugs, and it covers outpatient prescription drugs and certain vaccines. So how Medicare Advantage works, so it's always provided by a private health insurance company like Dean Health Plan Prevae360. They're directly contracted with CMS, which is the Centers for Medicare and Medicaid Service. Provides all of your Part A and Part B and sometimes Part D benefits all in the same plan. There are plans out there that are known as MA plans that do not include the Part D, and we'll talk about that a little later. They always provide a maximum out-of-pocket protection. They always include everything that original Medicare covers and may also offer additional benefits that Medicare doesn't, like dental, eyewear, in-home support, over-the-counter drug benefit, and more. One thing to note is you cannot have a supplemental policy and an Advantage plan because Advantage plans replace original Medicare. Now we're going to talk about Medicare Part D. So Medicare Part D is standardized by the government. So these 4 stages that I'm going to discuss here, these are the same on any Part D plan that you look at. The dollar amounts, the percentages, those are standardized by Medicare. So the first stage is your initial coverage or deductible stage. And as we talked about with the deductible, you're responsible for a certain dollar amount, and it's the same here. So with our deductibles for our drug coverage, it only applies to drugs that are in tier 3, 4, and 5. So tier 1 and tier 2 drugs do not have a deductible. So if you have a tier 1 or tier 2 drug on our plan, you move right to stage 2. If you have a 3, 4, or 5, you do have to meet your deductible before moving to stage 2. In stage 2, known as the initial coverage or copay and coinsurance stage. So you pay a copay or percentage of the total drug's cost, and you stay in this stage until one of two things happen. Either the year ends and you go back to stage 1, or when you and Dean Health Plan have paid $4,430 within the plan year. And that's total cost of medication. So for example, if you go pick up a $200 medication and you have a $45 copay, so you've paid $45 and Dean pays $155, that full $200 goes towards that $4,430. If you do hit that $4,430, you move into stage 3, which is the coverage gap, or better known as the donut hole. When you're in the donut hole, you do pay 25% of the cost of all of your medications, and you would stay in the donut hole until one of two things happened. Either the year ends and you go back to stage 1, or you reach an out-of-pocket cost of $7,050. One thing to note is this out-of-pocket cost is not made up of anything that Dean Health Plan has paid in stage 1 or stage 2. If you do reach that $7,050, you move into stage 4, which is known as catastrophic coverage. When you're in the catastrophic coverage, you pay 5% or a small copay, whichever is larger, and you will remain in the catastrophic coverage stage until the year ends and you will go back to stage 1. Some Part D information formulary. So that's the list of drugs that are covered by the plan. So every plan has a different formulary. And the formulary is going to give you information like what tier level the drugs fall under, if there's any special excuse me, if there's anything that about the medication, like for example, if it requires prior authorization, or if there's a quantity limit, meaning they can only dispense X amount in a certain amount of time frame, the formulary will list any of that information. As I mentioned, drug tiers, so each drug belongs to a tier, and the tier determines how much you pay for that drug. Usually the higher the tier, the more you pay. Network is going to be the pharmacy options that you have for getting your prescription drugs. And then the difference between brand name and generic. Brand name drugs are protected by a patent. They can only be made or sold by that company that holds the patent. Once that patent does run out, other companies can use that active ingredient to create generics. Generics are always approved by the FDA as having the same active ingredient as the brand name drug, but are generally going to cost less. So Medicare Part D is optional, but it can be very valuable if you take medications. Now, if you do not take Part D when you are initially eligible, Medicare can penalize you. Now, the exceptions are if you've had credible coverage, for example, if you're covered by an employer plan, or you have some other coverage like Wisconsin Senior Care, or if you've qualified for extra help, which we'll talk about in just a moment. So if you did not sign up for Medicare when you were initially eligible and do not have a exception such as credible coverage or extra help, you can be subject to a penalty. So that penalty is 1% of the base beneficiary premium, which is essentially the average of Part D plans. And it's multiplied by the number of months you went without Part D coverage. It works out to about $4 per month for every year you went without drug coverage, and that is added on to your premium. And that amount can change because that base beneficiary premium can change each year. So people with limited income or resources may qualify for extra help. Extra help is a Medicare program that helps pay some medication prescription drug costs, such as monthly plan premium, yearly deductible, coinsurance, and co-payments. And one nice thing is if you qualify for extra help, you are not subject to the coverage gap or late enrollment penalty. And also, if you qualify for extra help, you have what's called a continuous special enrollment period. And that means that you are able to change your plan throughout the year because having extra help is considered a special enrollment period. So at Prevae360 Dean Health Plan, we are considered an integrated delivery network. And what this means is it's a true collaboration between healthcare experts, hospital partners, and Prevae360 Health Plan, leading to a streamlined and simpler experience for members. Our roots are local. Our health plan employees are your friends and neighbors, and you'll find your primary care providers just down the road. Community is important to us. Our employees participate in a variety of volunteer efforts throughout the year to make life a little better for everyone. Our plans offer a suite of premium benefits to give you a Medicare plan that covers your health needs, including dental, vision, and more. To look up providers who are in our plan, the most up-to-date listing is always going to be available at prevea360.com/doctors, or you can call our customer care center at 877-232-7566, and they can look up a provider for you, or they can mail you a printed directory. So our pharmacy network is made up of both preferred and standard pharmacies. Members save money by filling prescriptions at preferred retail pharmacies and through our mail order pharmacies. In 2022, our preferred pharmacies are going to be Walgreens and Walmart, and also Costco retail and mail order. And one thing to note is you do not have to be a Costco member to use the Costco mail order pharmacy. Members also have access to standard retail pharmacies. These are going to include most national pharmacy chains like CVS, many retail and grocery store pharmacies, and many independent community pharmacies. So timeline to enroll. So when you are first eligible for Medicare, everyone gets a 7-month period known as their IEP or initial enrollment period. And this is during which you can enroll in Medicare for the first time. This includes the 3 months prior to the month of your 65th birthday, the month of your 65th birthday, and the 3 months after your 65th birthday. If you are enrolling for the first time due to disability, your initial enrollment period is based off your disability dates. What this means is after 24 months of receiving disability, you are eligible for Medicare on the 25th month. Annual enrollment period is the period we are in right now, and that runs October 15th to December 7th of every year. And this is a period during which you may make changes to your medical and prescription drug coverage. And any changes made during this time will become effective on January 1st. For Medicare Advantage members, there's also what's called the MAOEP or Medicare Advantage open enrollment period. And this runs every year from January 1st to March 31st. During this period, you may make a one-time switch from an Advantage plan to another Advantage plan, or disenroll from an Advantage plan and go back to original Medicare. And that change can be from one carrier to another, or if a plan offers different options, you can change within a plan. One thing you cannot do is go from an Advantage plan to a supplement, or from a supplement to an Advantage plan during this time frame. And then special enrollment periods, there's a number of special enrollment periods. We just talked about extra help and having a special enrollment period for that. Some other ones are if you retire and you leave employer coverage, that's a special enrollment period to sign up for a Medicare plan. Another one is if you make a permanent move out of your current plan service area, you have a special enrollment period to join a plan. There's a number of other special enrollment periods as well. So as far as eligibility, you do have to have Medicare Parts A and B and continue to pay your Part B premium to Medicare. You also must be a permanent resident of one of our Prevae360 Advantage service areas. And those include Brown, Chippewa, Dorr, Eau Claire, Kewaunee, Oconto, and Sheboygan. And we're very excited to have added Chippewa and Eau Claire counties to our Prevae360 Medicare Advantage this year. And also note that you do have to be a resident of the planned service area for a minimum of 6 months of the year. So if you are a snowbird and you spend more than 6 months out of the service area, you would not be eligible, but you can spend up to 6 months out of the service area. So Dean Health Plan's Medicare Advantage plan removes the hassle of 3 different policies: Original Medicare, standalone prescription drug, and a supplemental plan to reduce out-of-pocket cost, all while providing coverage members need. All of your Part A and B deductibles are covered with the Advantage plan. There's a maximum out-of-pocket limit that protects members from large catastrophic healthcare expenses. Members can get up to $300 back on their Social Security check annually with a Part B premium reduction, and we'll talk about that when we get into the plans. Prescription drugs are covered with manageable cost sharing according to our drug formulary, and that is applicable only for our MAPD plan. We'll talk about that when we get into the plans. All of our plans cover preventative and comprehensive dental, 100% coverage for gym membership to an in-network health club through Silver and Fit. Members also get a $50 over-the-counter quarterly drug allowance, and we'll talk about that in a little more detail. Members have the opportunity to earn wellness rewards and incentives for tracking their healthy behaviors. And members also get great health care from doctors they know and trust. So we're offering 2 plans in 2022, the Essential HMO point of service and the Harmony HMO point of service, which is an MA only plan, meaning it does not include drug coverage. And we'll talk about that, what that means in just a moment. So first, we're going to talk about some of the supplemental benefits that come with our plans. And the first is the dental. All of our plans include coverage for both preventative and comprehensive dental through our partners, Delta Dental, and that is their Delta Dental Medicare Advantage network. One nice thing is our plan has no waiting periods and no deductibles or coinsurance. It's a very simple copay structure. We've partnered with Papa, a company that connects you with screened and trained Papa Pals who provide assistance with organization, light housework, technology, and transportation. Your pal can visit you in your home or virtually for up to 10 hours per month, and you'll be matched based on your shared interest and communication style. This is a great benefit for someone who's living alone or someone who just wants some extra companionship. It's a very nice benefit. As I mentioned before, all of our plans offer a $50 per quarter over-the-counter drug allowance, and you can use this on over-the-counter supplies like bandages, pain relievers, cold and flu medication, vitamins, and much more. You can use your OTC card to shop online at participating stores or over the phone. Participating stores include CVS, Kroger, Walmart, and Walgreens. And that $50 per quarter is a use it or lose it. So if you don't use the full 50 when the new quarter starts, it does just go back up to 50. That the money does not stack. All of our plans offer a hearing and vision exam with no copay at an in-network vision provider. And then also a $750 allowance every year towards the purchase of hearing aids at our in-network hearing aid providers, and a $200 allowance every year towards the purchase of eyewear at our in-network providers. Transportation is provided by Lyft, and we cover up to 24 one-way rides each year to medical appointments or to the pharmacy to help keep you well. We also offer a post-discharge meal benefit, If you are discharged from the hospital or skilled nursing facility, we will cover 14 meals that are delivered directly to your door. You can either organize this through your discharge coordinator, or you can call our customer care center. The meals can be heated and eaten at your convenience, excuse me, and they can meet a variety. If you have any dietary needs, such as low sodium, low carbohydrates, if you're a vegetarian, they can meet any of those dietary needs. The Silver and Fit programs includes, as I mentioned, a fitness membership to any of their in-network gyms, a home fitness kit, which can include a Garmin, Fitbit, or other exercise equipment, and 8,000 on-demand videos available on their website, or they have a mobile app as well. Chiropractic care. All of our plans cover additional chiropractic benefits that help members stay well, healthy, and active. A 24-hour nurse line. This is a great benefit. I use this a lot because I have young children. If you ever have a question about, do I need to be seen right away? Do I need to go to the emergency department? Do I need to go to urgent care? Can I wait until tomorrow to see my primary doctor? They can help you with any of those questions, or even if you have questions about how medications might interact with each other, or just if you're feeling off and have a question, there's trained nurses are there 24 hours a day, 365 days a year to help you. And then Living Healthy Rewards. We offer rewards for doing healthy activities. You can earn up to $150 in rewards for completing healthy activities like receiving a flu shot or getting an annual wellness exam. You track these on the website, and the payout is in gift cards because we're not allowed to give cash per Medicare. So there's about 400 different merchants, big box stores, restaurants, Amazon, but you can earn up to $150 in rewards each year. So now we're going to talk about our two plans. And as you can see, there's the Essential HMO point of service and the Harmony HMO point of service. What point of service means is you have voluntary out-of-network benefits. So with any of the plans, urgent and emergency care is covered regardless of where you are. So if you are traveling and you have an emergency medical situation, go get the care, and it's going to pay just as you are in network. What the point of service option is, if you want to see a non-plan provider and don't want to get a referral or authorization to see that provider, you can do that. It's just going to be a higher out of pocket. Now, because we don't have contracts with these providers, they do have to agree to bill the insurance. And if a service you're receiving from a non-plan provider does require authorization by the health plan, you do have to get that authorization. So the Essential HMO point of service does have the Part D coverage and has a $0 monthly premium, and it also has a $25 per month Part B reduction. So what this means is the money that Medicare takes from your Social Security to pay for Part D, or if you pay it on your own, that premium is reduced by $25 each month. With the Harmony HMO point of service, that does not include the drug coverage. And on the next slide, we'll talk about people that this would be a good fit for. There's no premium, $0 monthly premium for the Harmony. And that one has a $50 per month Part B reduction. For both plans, there is no PCP copay. Out of network primary care is $50. Specialist in network is $35. Specialist out of network is $50. Outpatient copay, so outpatient surgical services. In network, it's a $275 copay. Out of network, it's a 20% co-insurance, and that 20% is off the allowable charge. It is not off of the billed amount. Hospitalization, it's $325 per day for the first 5 days in network, and $500 per day for the first 7 days out of network. Now, again, if you are hospitalized, say you're traveling and you have a medical emergency and you're hospitalized, that's still an emergency and that's paid as in-network. So this out-of-network hospitalization would be you're voluntarily going to a non-plan provider to receive some kind of inpatient surgery or something along those lines. Urgent care is the same in and out of network, and that's 35. Emergency room is also the same in and out of network, and that's 90. The max out of pocket for in-network is 4,500. And combined in and out of network is 6,000. So the in-network max out of pocket is 45, or any combination of in and out of network reaching 6,000, you meet your out of pocket maximum. So as I mentioned with the Harmony, it does not offer prescription drug coverage, and with Advantage plans, you cannot add standalone prescription drug coverage. So this is an excellent choice if you already have prescription drug coverage through Wisconsin Senior Care, TRICARE for Life, VA, or an employer plan, because you cannot enroll in a Part D plan if you enroll in the Harmony plan. The Essential plan does have a $250 drug deductible. Again, that only applies to drugs that are tier 3, 4, or 5. Tier 1 drugs at a preferred pharmacy, there is no copay for a 30 or 90-day supply. It's a $7 copay for a 30 or 90-day supply at a standard pharmacy. Tier 2, it's 5 and 10 for a 30 or 90-day supply at a preferred pharmacy, and 12 and 24 for a 30 or 90-day supply at a standard pharmacy. Tier 3, you do have to meet your deductible first, but then it's 40 or 100 for a 30 or 90-day supply at a preferred pharmacy, or 47 and 117.50 at a standard pharmacy. Tier 4, once deductible has been met, it's 90 or 270 for a 30 or 90-day supply at a preferred pharmacy, and 100 and 300 for a 30 or 90-day supply at a standard pharmacy. Tier 5 specialty medications, you pay a 28% coinsurance. And then, as I talked about earlier, stage 3, that coverage gap, you do pay 25% of the cost of all of your medications. And then if you do reach stage 4, the catastrophic, you pay 5% or a small copay, whichever is greater. So Part D vaccines. So you pay a $0 copay in all stages for covered Part D vaccines, including shingles and Tdap. These $0 vaccines are listed in the drug formulary as tier 6. And with Part D vaccines, one thing to note is you do have to get those done at a pharmacy. You cannot get those done at a doctor's office. Now, there are Part B as in boy vaccines that you can receive in a doctor's office, and these include the flu shot, the pneumonia shot, and the hepatitis vaccine. For anyone who is on insulin, we do have a senior savings program. You will only pay a $30 copay per fill at a preferred pharmacy, or a $35 copay per fill at a standard pharmacy. And this is all the way until you reach the catastrophic coverage stage. As with the provider guide, the most up-to-date formula listings are available at Prevea360.com/Medicare, or you can call the customer care center at 877-232-7566, and they can look up your medications or send you a printed formulary. Some of the values of the Prevae360 Advantage. So these are benefits that are included with no copay or cost. All primary care visits, both in-person and telehealth, routine vision and hearing exams, meals post-discharge, transportation, in-home support, dental exams, cleanings and x-rays, vaccines, mammograms and pelvic exams, preventative colonoscopies, prostate cancer screenings, diabetes screenings, testing supplies and self-management training, and e-visits for eligible conditions. And then some of the benefits for diabetics include $30 insulin fills at preferred pharmacies and $35 insulin fills at standard pharmacies, $0 copay for a continuous glucose monitor, and we cover the Freestyle Libre and Dexcom. CGMs, no copay for PCP and lab services, 20% coinsurance for insulin pumps, and you do get 2 extra cleanings per year on the dental if you're a diabetic. And then you can use your over-the-counter drug benefit to buy things like diabetic socks or glucose tablets. And just note that those $30 and $35 insulin copays, those go until you reach the catastrophic coverage stage, which you would pay 5% if you're in the catastrophic coverage stage. So things to consider when you're looking at plans. Cost is obviously very important. Doctors and hospitals, you want to make sure the doctors that you want to see and the hospitals you want to use are covered by the plans. You want to make sure the prescription drugs you're taking are covered and how they're covered. If you plan to travel, you want to make sure that the plan will cover you when you travel both in and outside of the US. If the things like gym membership and dental and hearing and vision are important, you want to make sure that the plan you're looking at covers those things. And then you want to make sure that you are satisfied with the quality of care you're receiving. And that's not only on the care delivery side, that's on the claim side, customer service, billing. You want to be fully satisfied with your quality of care. So if you are ready to enroll, you can do that online at Prevea360.com/Medicare. You can also do that over the phone. Our sales number is 877-234-0126. You can also mail in an application. Now, if you mail in the application, I always recommend that you call prior to December 7th just to make sure that the application was received, because it doesn't matter when you send it. If it is not received in-house by December 7th, it is not a valid application. So if you do mail it in, I just always recommend calling to check to make sure it was received, because if it wasn't, we can just do an application over the phone for you. Where to go for questions? Again, you can always call our sales line at 877-234-0126. You can meet with one-on-one with a Medicare consultant. You can do that Monday through Friday from 8 a.m. to 4 p.m. at a convenient location nearest you. Some additional tips and resources. Medicare.gov is a great website. It has a lot of benefit information about Medicare. It also there's a tool on there that I use just about every day, and that's the Plan Finder. And the reason I use that is to track prescription drugs. So you can actually go to the Plan Finder, input all of your prescription drugs, and then select the plan you're looking at, and it'll give you an estimated cost for your prescriptions. It'll tell you what the copays are going to be. It'll tell you if you're going to hit the donut hole. It'll tell you if you're going to get to catastrophic coverage. So it's a very useful tool. SSA.gov is Social Security's website, and that's another great resource just about benefits and other things included with Social Security. You can always call them as well. Medicare's phone number is 800-633-4227, and Social Security's phone number is 800-772-1213. I want to thank you all for coming to today's presentation. I hope it was helpful. And if you do have any questions, feel free to reach out to us and we would be more than happy to assist you. Have a wonderful day.